will probably only get through half my yard.
Wow.
Are you doing anything fun?
I think our interpreter is on. Let me see. Kids are during this. They
They're
really
good ages.
they're good ages.
Yeah.
They do what I say. Just turned 8, so they're 5th grade and 2nd grade.
Yeah, that's still good.
Like, yeah, they like are having tons of fun, but not pushing back too much. So it's been nice.
Good.
He's pushing the envelope on bedtime.
Just turned 14, and then 8-year-old.
Okay.
So we had the two pretty much. Going. She just loved being pregnant, loved it. Thinking maybe that time has passed now.
At the bottom of your screen, there is a chat. Ask questions in the chat function, or also if you click on participate, you can see a raise hand function. And so we could utilize that too, where folks could raise their hand. how to mute. So, and
Right.
yet they don't. Is anyone tuned into that? I watch it the next day.
Actually, they're one of the first schools to pull the plug right at the beginning of this, and they do WebEx, so everything.
Started. We're at 9 participants.
And what time is it?
7.
I think get started if, I mean, picking.
I am recording it though, so I'll share it with. I see that Jen Evans is on, so we can share it. And
Perfect.
Okay.
Thank you.
Derek, you want to kick it off?
I mean, I can, or Jillian, whatever. I could say a few words, and then I think Jillian and I are excited to hear from you all, right, in terms of what your, questions and comments and concerns are. So I'm just thrilled to be with you all. I'm an extrovert, so this has been just torture for me. My wife is an introvert, so she jokes she's been preparing her whole life for the pandemic. She's quite comfortable, being at the house. But I don't know, Jillian, you're probably somewhat of an extrovert as well, I imagine, right?
Interestingly, I'm a closeted introvert, so I am good to go.
Oh, okay, good. Well, you're fine either way. You do both sides very well, so that's great. Just to relay kind of a personal thing, just before, because it's really just fresh in my mind, just like 15 minutes ago, my son, who's in second grade, his teacher knocked on her door, and she was spending today returning the journals and the work and things that the students had left in their desks. And she wrote my Charlie a letter, and I apologize for the background. And this is the packet of the journals. Gosh, I should take off that virtual background. It's kind of disappearing. But I know this is somewhat off topic. I just want to read you the first 2 sentences. Dear Charlie, this has not been like any year in our lives. You left school quickly. You have been home for 2 long months. You're now learning more lessons than you thought possible from your parents, and you see your teachers through a computer screen. We may feel disconnected on some days. And she goes on to say that my hope for you is to remember the many lessons we've learned together, both in school and beyond the walls of Duffy. And I'm going to stop because I'm probably going to get emotional, but it's so sad. I think what our kids have lost, and they're fortunate that they're all still healthy. But I know there's just so much pain and that everyone's going through, and so things like this help. I don't know, they help me at least. Just to switch gears, I'm chairing the aging committee, and I'm eager to hear from you all in terms of if we do go back into special session, what are some priorities and things that you're interested in pursuing? I've been working, and I know Jillian's been vocal on this too, to try to address prescription drug costs. That's been a big thing. I've been pushing an anti-age discrimination bill that we had bipartisan support on and passed unanimously out of the Aging Committee. And that was teed up and ready to go. So I'm requesting that that be in special session package when we go back in. And then we've been working on nursing home visitation rights too, to ensure that every single resident in a nursing home or congregate care, long-term care, has the opportunity to connect virtually with loved ones, because that's been a real issue that I've heard from seniors, that they're really isolated and not able, right? I mean, it's really tough because some seniors, most seniors are in a high risk group and can't connect with folks. And some nursing homes and congregate care centers are great and get the iPhones or the iPads and allow them to visit with family members, but others aren't so great. So we want to make sure that every single senior in the state is able to connect with their loved ones. And then voting is the other thing that, and I know Jillian has been a real leader on this issue as well, in terms of ensuring that not only for the primary, but for the general election, that everybody can vote safely, and that especially for our high risk groups, that nobody's afraid to go to the polls. So that means that you could be able to vote by mail, even if you're not sick, but if you fear becoming ill. Really, we're like so woefully behind in terms of other states when it comes to voting. We have some of the most restrictive measures in place, and it's not just a Democratic thing. There's red states, so to speak, who are much better than us when it comes to just New Hampshire, as an example, of allowing folks to vote. And it should never be that you have to brave illness or stand in line for hours and hours. So I'm hopeful that we're going to be able to get something done on that as well. So why don't I stop at that? I know Jillian is going to jump in and talk about her priorities, and then we'll be eager to hear from you all. Wonderful. And thanks, Jillian, for arranging Mary Sue and for making sure that this is accessible for everybody. Thank you so much.
Happy to. Thanks, Derek. And thanks, Gina, for pulling this together. So I'm Representative Jillian Gilchrist. I represent the 18th District. And I've been saying this on many of these types of meetings. The job had always been constituent services, but since the pandemic happened, it's really become primarily constituent services. So on a daily basis, hearing from folks across the district on a number of issues. Never could have predicted how COVID-19 would impact people in so many different ways, emotionally, mentally, physically, financially. And in particular, in the last few weeks, the emails coming in about unemployment have just been tremendous. And so happy to serve in that role. Happy that people know that they can reach out and that there are folks willing to support them. But it really is eye-opening on how impacted our community and communities across the state are. So I would build off what Derek was saying with the voting. To me, that is such a pressing issue. I think for many, it seems a little far off because it's August or November. But based on what we are currently going through and what we just experienced, I don't think we can be too prepared. And so why not prepare for the worst and hope for the best? And so the governor did pass an executive order this week, which will expand absentee ballots. It's an expansion of the word illness. So currently, you can access an absentee ballot in the state of Connecticut if you have an illness, but that's been kind of the crux of how do we expand it. And so he did pass an executive order that would have COVID apply to that illness piece for August. His executive orders, I believe, end in September. And so the legislature needs to take action next to ensure that that illness piece is expanded for the November election. And I know Derek and myself are pushing big time in our caucuses, the Senate Democratic Caucus and the House Democratic Caucus, to ensure that when we go in for a special session, which we're hoping we will, likely at the end of June or in July, that's top of the agenda. The other thing I really wanted to highlight today are some of the services. So I know Derek had them on one of his live chats. I had this amazing group of students on one of my Facebook Lives, which I host pretty much every week. So if you are on Facebook, tune in. I have different guests on, including Secretary of State Denise Merrill, who spoke to voting rights on one of my Facebook Lives. But the young men from Conard High School who have started WeHa at Your Service. And so this is a service specific to seniors in the community of West Hartford, and they will go out and do shopping for you so that you don't have to go to the grocery. I don't know about you, but I washed my hands, but I wasn't as intense as I'll be going forward. So seniors are obviously in a higher risk population, but I think for all of us, this has just opened our eyes to the amount of germs we encounter on a daily basis, and going to the grocery store is really intense. Having to put the mask on, and you're passing people, and who's touched this, and I carry around Clorox wipes now, and so that service, these 3 young men are just remarkable, and they have over 20 volunteers at this point in time, and they'll go out and do that shopping for you. Some of the other priorities I've been working on, when this first all happened, some of you heard me speaking when this first started. I do have 2 young kids. Thank goodness they're healthy. They do well in school. And yet I was overwhelmed. I'm a working mom. I usually work about 70 hours a week and juggle the mom thing. But school is a huge support for me as a working mom. And the thought that, oh my goodness, I'm going to be home now balancing both was really overwhelming. And one of the first emails I got was from a parent of a student with disabilities. And it was this light bulb moment of, oh my goodness, if I think I have it tough, there are a lot of families who have it a lot tougher. And so I've been working with a lot of families in the community who have children who have disabilities K through 12 to figure out how we can support them in this distance learning going forward, because it's being figured out, but it's not there yet. And a lot of these students are falling significantly behind, and the parents are really overwhelmed. And so trying to get them some supports. And then most recently I chair the subcommittee on women and children's health for the Medical Assistance Policy Oversight Committee at the Connecticut General Assembly. And we just launched a work group to look at the needs of pregnant women, women who've just given birth, and then infants. And so during COVID. So those are some of the other things I'm working on. But similar to Derek, I'm going to stop there. And I really want to hear from the folks on this call. Since it is a small group, I'm going to go ahead and unmute everyone with the hope that we can have this conversation without feedback. All right, you all should be unmuted unless you muted yourselves. Any questions?
Here, a pooch. What kind of dog? Brazel? I see. I can't tell. I'm not a dog expert. I can't tell what kind that is. Can you tell, Jillian?
No, I have a Bernese Mountain Dog, so it sounds like a smaller dog to me.
I would say while you're thinking of questions, if you have any, if you need anything, if we can be helpful, some stuff may seem like, well, you don't want to bother us or whatever, but as Jillian said, we're not doing a lot of legislating right now. I mean, we're not in the building. And I'll just give you an example of something that we could help with. I had this couple, Harold and Ida Ducey, and they're in their 80s, and they were right at the beginning of this, their cable stopped working. And if you can imagine, being stranded in your house and not being able to go out at all, and this was a real lifeline for them, and they couldn't get Frontier to come and fix it. And I guess they said they'd have to wait until after the pandemic. And so finally they were at their wits' end, and they reached out, and I called Frontier's, they have a lobbyist who actually lives in West Hartford. Anyway, and we got Frontier out and got their cable fixed. And I know that seems kind of like a weird thing for maybe a legislator to do, and I'm sure Jillian has probably tons of examples of like this too, kind of, odds and ends, but it really did make a big difference for them. And so if there are things that, whether like that for you or for your friends or something, just please, I hope, Jillian, you don't mind me saying this, but like use us as a resource, because we might know somebody and we might, be able to call somebody, right? In this case, it was Frontier, and it really did work. So anyway, I would encourage you, if you have stuff like that, to let us know.
So I do see that Roselle raised her hand.
Oh, great. That may have been the dog, actually.
No, she used the raise. Let's see. Okay, but all right. Yes, I do, but I don't know how to get my picture to show. Roselle, look at the bottom of your screen. There usually is a video icon, and you can turn the video on.
There you go.
So that it's showing like a picture of you, but not you live. Otherwise, you could type your question in the chat.
Awesome.
I hear typing.
Great.
Okay, so I see you say, I recently found an FDA approved clear face mask that is available. To hospital workers, and to the group that I volunteer for, Communication Advocacy Network, Inc. in Hartford. So the question is, so they're purchasing that for senior deaf clients and for our adult deaf blind. But she's saying, but I was hoping that someone here could make an effort to make these masks available to more service providers, to people in stores where we go to shop. Great point. And to audiologists. To anyone we interact with. Is that something we can help with? And then I'll get to that next question in a second. So I'll jump in and then I'll turn it over to Senator Slatt. So thanks, Roselle, for the question. So from the beginning of this pandemic, first it was the PPE, and now it seems to be the well, then it was the testing and it's the face masks. I mean, the face masks are a part of the PPE. There have just been a shortage across the country and in our state. And so I don't think it's so much a matter of us not wanting to get these materials to folks. It's that there's a shortage of being able to get them. Now, if you could share with us, Roselle, where you're finding that material, what is great is that the governor's office has set up, we have a point person, and so we can connect with them to let them know where we're hearing more PPE can be gotten. We can also now connect with the governor's office point person to explain where we think PPE should go out to. But when it comes to healthcare providers and frontline workers at the grocery, they're on the priority list. And so it's just a matter of us being able to get enough PPE into the state to get it to them. I'll stop there though, and Derek, if you want to jump in.
No, I think that's right. There is a partnership that the governor's office and CBIA, which is the big business industry lobby, they formed to help get PPE to small businesses, and that would certainly include, as Jillian said, masks. And I think that what we can do is communicate with the governor's office and make sure that, on their radar screen are these clear masks. Rosella, I think that's a great point. And I think that maybe oftentimes that might get overlooked. I think oftentimes in situations like this, I mean, this is so much obviously unprecedented, a pandemic. I mean, last time was 100 years ago, but that certain inequities made there and are made. We see that in terms of educational opportunities. We sort of see that in terms of healthcare and communities of color, and we see that certainly in folks with disabilities. Julie mentioned that with education and equity there, all across the board. I think this is one of those areas that if we're not really vocal, this can be something where people may forget about it, that, no, there really is a need for this. So I'd be happy to also contact the governor's office, and if you could share with us. I mean, we could just talk about clear face masks in general, but if you have any details on, who manufactures them or whatever that you could share, that would only be beneficial. But I really appreciate you bringing up this point. I think it's a good one.
Agreed. We have another question in. What can be done to ensure nursing homes are testing workers? Great question. And I've gotten a few emails on this from constituents who are very concerned. I'll go, and then Derek, please jump in. The nursing home issue, it's been really intense at Connecticut's nursing homes. The virus has hit them hardest. And to the best of my knowledge, it's been an issue of accessing tests. And so as the state has gotten more access to tests, they've been getting those to nursing homes, but have only been able to focus on patients who were showing signs of COVID. Then I believe the next step was all patients, and then the next step was the workers. There was also a change up at the Department of Public Health. Not that that's unfortunate that has occurred during this time, because it should have been laser focused on focusing on the people who were most impacted in those nursing homes, the individuals in the nursing homes and the staff. But I think that's some of the holdup. Again, I think the primary holdup is just getting access to the tests. So it is the plan that all workers at the nursing homes will be tested, but I don't think we're there yet. But the Senate gets a lot more one-on-one conversation, so maybe Derek has some additional details.
I would add just that I think that on balance, the Lamanis administration has done a good job. Nursing homes, one area that we've really not done what we should have in terms of the administration. In terms of, I mean, it really has been an awful situation. In West Hartford, I believe there's 8 nursing homes, congregate care, long-term care facilities, and more than 50% of the positive cases in West Hartford have been, I believe, at those homes. And I think the last statistics I saw was 85% of fatalities in West Hartford were in those were in nursing homes. So it's a real issue. I do think in the next week or so, everybody's going to be getting tested, both workers and residents, but that should have happened a long time ago. And, when we go back into session and when we reconvene, one of those things that we're going to be doing not only is passing legislation, appropriate ones to help the state recover, but also I think we're going to be taking a hard look at, what did happen and how it could be improved. And we have a responsibility of oversight, I guess I would say. And I think this is one of those areas that did fall short.
So I do see that, Roselle, we see you now, which is fantastic, and your hand is raised.
Yes, I was wondering, could you give me more specific address of where I could send this information about the masks? I want to make sure it gets directly to you.
Great. We can both enter our emails into the chat, and then you'll have our contact information. So if you just email us, that'd be fantastic.
Okay, all right, sounds good. I'll do that. Thank you.
Thank you.
And is there a timeline that they're thinking about possibly opening up the nursing homes or long-term care facilities to visitors? I have a very dear friend who is stuck there and has not had a single visitor, and I feel badly.
Derek, do you want to jump in?
Yeah, I've heard September, but that doesn't mean that everything is going to be wide open then. But I think that nothing will change
Oh.
to September. That's one of the reasons that we've been pushing so hard for a guarantee of virtual visits. So, and I know it's not the same thing as hugging your family member. Right now, the visits can only occur if it's near end of life. Right, but otherwise you're not allowed to have the visitors come in.
Well, thank God that's not the case.
Right. So we want to, and I get it, like why there are a lot of safeguards. We were just talking about the statistics and that people who are at high risk, and we want to make sure we protect everybody's health. But it is tragic to think about folks who are older, who are in nursing homes, and they're not able to see and to reach out and give a hug to their grandchild, right? So I think it's going to be another few months, and in the meantime, we're going to do everything we can to ensure that there are virtual visits. Jillian, did you want to add anything?
No, I think that's fantastic. I'm happy to see that the executive order did pass that requires some type of communication. And we were, I guess I will add, I was on a phone call last week. It was a different social service agency, but they had said that they had purchased some iPhones so that their patients could be doing FaceTime. So I think there's some creative things happening to ensure that folks can at least see their family members. To Derek's point, it doesn't change the fact that you can't hug, but it does help to see. Again, with little kids, I keep explaining to my son, like, we are so fortunate to have FaceTime. Like when I was a kid, you couldn't see people. So the fact that there is Zoom and that you can actually see people is helpful.
There was a bill, interestingly, that was introduced by Bobby Gibson, who was the state representative. He's on the education committee with Jillian, and he's from Bloomfield. And he introduced a bill in the aging committee prior to the pandemic arriving here. This was in January, that was going to require virtual visits in nursing homes. And we had no idea. And so we were moving the bill along in the aging committee when the pandemic hit and the session was suspended and then essentially canceled. So kudos to Bobby for being on top of it. And we need to get that bill passed, I think, because we may not have another one of these for 100 years, but there's going to be other things, I think, coming, right? Where there's going to be potential for whatever reason where people are going to not be able to have visitors. And, for people's mental health, it's so important, I think, to feel connected.
Yes.
Any other questions? You could, again, since we can see everyone, either raise your hand or you can use the raise hand feature or type a comment in the chat box. Oh, I see May Young has a question, and I'll unmute you. All right, you're ready to go.
My question relates to assisted living, which is different from the skilled nursing. would visitors be restricted there also until September?
I believe so. I think it's the same, but I can find it. I can follow up for you. I'm happy to do that. But I think they are the same.
See, my problem is it doesn't really affect my husband, but the other residents where he is at Arden Courts in Farmington, which is a memory care community. And those residents have really been affected by this immensely. And it has really, well, they are just so depressed by this, not having visitors. The facility did initiate Skype visits, maybe the third week of the visitor restriction, but that, as you say, is still not the same. Wouldn't visitors there be able to visit sooner than September?
I think it is still September, but I can confirm, but I'm almost positive that it's the same for for both for any of those long-term care facilities. But May, when you asked that, I raised made me remember something that not only I think are the visits super important just for feeling connected and mental health and fighting depression, like you said, but also to ensure quality of care. There's that saying that, and my mother was a geriatric nurse. She just retired. And so, she always said, it was really smart when the family members would come and visit, and they would never come at the same time every single week, and that to mix it up a little bit. And I'm not implying that, the nurses aren't doing a great job, but just that, it's really good when family members come and visit and make sure that their loved ones are okay and come in different shifts and check in. And that does have an impact. This is coming from my mother's perspective, again, a geriatric, a floor nurse at a nursing home, that's a good thing to have it for, advocacy for the residents. So that's another reason why we need to get these virtual visits, ensure that they're in across the board.
Anyone else? Any questions? Oh, Roselle.
Yes. My question is unrelated to the visits, but I am curious if there is a plan for having these kinds of discussions like this, and how will they be set up? How will they, because I'm thinking, can we make them accessible with captioning also? I'm just thinking, I happen to be very fortunate because I understand Mary Sue, and she's a wonderful interpreter, and thank you for getting me the interpreter. That's great. But there are those who prefer captioning, but there are also deaf people who don't even know how to sign, or older people who can't use sign language. And so they really rely on the captioning. So I just want to make sure that accessibility is there for everyone who's deaf and hard of hearing in Connecticut, so that they can benefit from these types of opportunities, these, town hall meetings, these kinds of meetings, things like that.
I think that's an excellent point, and I thank you for raising it. And I'm happy to bring that back to the various state agencies and the governor's office to say, as they roll these plans out, to please take that into consideration, because I don't know the answer, but I think it should be planned for.
Yeah.
Thank you. Thank you.
And it was a constituent who brought to me, here's an interesting issue. So I have a deaf constituent who is very active in the process. And so whenever I have coffee hours, I get an interpreter. He wanted to come to the legislature and have a one-on-one meeting. And so I was able to get an interpreter. And in that meeting, he shared that during the budget cuts a few years back, I guess it was 2 or 3 years ago, the legislature cut funding for the closed captioning on the Connecticut television network. And so since that time, there had been no closed captioning. And when he raised it, he assumed I knew, and I didn't, because we can't know everything. And so him raising it was such an important issue. I couldn't believe that it happened. I actually found out that behind the scenes, there was this assumption that if they cut it, there would be a lawsuit. And so it would immediately have to go back into effect, but no one ever complained. And so it didn't. And so I then went to legislative management. Well, long story short, they are putting the closed captioning back this fall, using newer technologies, because they used to have to type it in all in hand, but now they're going to use a computer service. And so by the fall, I'll check in again, because I don't know if the pandemic slowed down the timing. But the idea was by this September, October, there'd be closed captioning again on all CTN.
Thank you for doing that, Jillian. It's outrageous that because of cuts, can you imagine people saying, well, we're not going to make this ADA compliant, this building, because of, budget cuts. I mean, it's just like that. That's not acceptable. It shouldn't be acceptable. So,
agreed.
We've gotten, I don't know, Jillian, I feel like you were in this meeting with me where we heard this, but that the Capitol itself is not, there were complaints about the Capitol just not being accessible to folks. And that, I mean, that's one way, right, that the government is inaccessible, but just in terms of the way that people, and I don't want to get too far down this rabbit hole, but the way that people testify on bills and are supposed to, block out entire days to come to committees. Mm-hmm. There's certain parts of the Capitol that, it's very old, but that folks can't get to if they're not fully mobile. There's just a lot of ways that I think we could start with state government itself and make it more accessible to people.
Agreed.
Kathleen, did you have a question?
Yes, I did. Actually, it was in regards to the absentee ballots that now COVID has been included for people with health issues. Is this something that's yet to be voted on, or has it already been decided that will be the protocol going forward? It would be important for Gina and I to be able to communicate that to our membership. We have a publication that's coming up. So I was just wondering if that was timely information that we're receiving today.
Go ahead, John.
So twofold. Yes, it is timely information because the governor did pass an executive order which applies to the August primary. And the Secretary of State will be mailing out absentee ballot applications to all eligible voters. So whereas in the past, a voter would have to go proactively seek the absentee ballot application, they will now be sent that application just because they're a registered voter. And so for the primary in August, this new definition of illness pertaining to COVID does pertain. The legislature, needs to go in and change it for the November election.
Okay, that hasn't been done yet. Okay, so this is just specific to the August primary.
Yes.
Okay,
Yeah.
But they will be mailed. Everybody will receive when it's eligible.
Yeah, which is fantastic.
Wow.
I think. Some people disagree, not Derek. Other people, we have some pushback in the state, but I think it's a good thing.
Yeah, there's some states that do this. Washington State is one that does it just completely. Is it Oregon? Maybe it's both, but by mail. And as Julian said, the legislature should go in and do this as soon as it's safe. If we have it done by executive order for the general, the fear is that there'll be a lawsuit by some group, whatever, that is not so into making voting safe and accessible to everybody, and that the results of the election, who knows, could even be challenged, and that so it's much stronger if we come in as a General Assembly and pass it that way. So that's the difference between the primary and the executive order. Got to get it done now, but And I think we're ready to, I'll put on my face mask and do whatever I need to do to get there and vote. So hopefully we can do that relatively soon.
I have a question.
Sure.
For me, as a deaf person, how could I best advocate to make sure that gets passed for the November election? What's the best thing I could do?
So you can reach out to your elected official. If it's Derek or I, still reach out, but know that we support it. Also reaching out to your family and friends in the state and encouraging them to reach out to their elected officials. I think the more buzz there is around this and the more people who understand the urgency now, sooner than later, I think is best.
Yeah, I would add that the AARP is very involved and engaged on this. This is one of their top issues. So if you are a member of AARP, you could, and you have their contact information, you probably get some updates and some communication from them. They've been reaching out to legislators too, so you could go kind of through them, because they're, as you might imagine, they're really vocal on this. I mean, you can always reach out, obviously, to Jillian and myself, but it is you're so to speak preaching to the choir. It's the folks who, and I really try hard not to be partisan, and for the most part, it's after the election we put the D and the R aside and we work together. This has, to my dismay, become a partisan issue, and it's really frustrating. And it's not necessarily this way in other states, but we couldn't get one member of the Republican Party to vote for early voting last General Assembly, which means that it'll take multiple more years before us to be able that we can have a referendum for you all to approve a change to the constitutional amendment to have us join the majority of the states in the country to have early voting. We couldn't get one Republican. So that's frustrating to me because it's frustrating to you, and that this is why we have to go through part of this process here. So again, my apologies. I love all my Republican constituents and work hard for them. So if any of you are Republican, no offense intended, but in the legislature, this has become a partisan issue.
On that issue, can I say something about that?
Sure.
So if I were to write to someone not in my district, maybe who is opposed to this, and say that I'm in support of this, I mean, would they just kind of throw it out? I mean, is that even worth it? Or do I just need to focus on who represents me?
Well, are you West Hartford?
I'm in West Hartford, yeah.
Yeah. Your delegation supports it, whether, I don't know who your state rep is, but both Tammy Exum and Joe Varengia are good on this issue. If you have friends in other parts of the state, that would be a good one. If they, that'd be great. I mean, most lawmakers will listen to constituents if they get a bunch of folks who are engaged on the issue, or it'll give them some pause to think about it. So I would think about that. If you have some friends who, live in, Hamden as an example, or that's one town that I'm thinking of that has a Republican state senator, but who might be amenable to it. I don't know, Jillian, do you have some?
I would echo it. It's much stronger when it comes from a constituent. So your time is best spent if you can think through who do you know in other towns and have them contact their state rep versus reaching out from West Hartford to a state rep who opposes it. Because at the end of the day, they know you're not voting for them. So.
Yeah, got it. Yeah, you're right. That's true. I am on Twitter quite frequently. And so I'm always talking about something, so I was thinking, I wonder if that has anything to do with it.
That's good too, because that gets the buzz going for other people who, again, that this might not be on their radar. So just sharing it out and making people focus on it, I think is important. Because I think a lot of people just assume, of course, it'll get worked out. And then when it comes, and if it's not, then that's when the trouble hits. So it's important for them to be engaged now, leading up to August and November.
Yeah, that's true. Yeah.
Any other questions or concerns? We both shared our emails and our cell phone numbers. So if you do have any follow-up, please feel free to reach out to us at any time.
Can you leave that up there for a while so I can copy?
Yes, that's in the chat.
I took a photo, and with your permission, I might post it and tag Jillian and let folks know that we're open to talking to groups like yourself and other seniors. Is that okay with everybody? I don't want to violate anybody's privacy.
It's fine.
Okay. Okay.
I did have a question in regards to phase 3 of opening. Has there been any update from the governor in terms of the inclusion of senior centers in phase 3? Didn't know if you had any inside information on that or any updates to share.
That's a great question. I haven't. To the best of my knowledge, phase 2 was really just kind of initially rolled out. And so I haven't heard much about phase 3. But I certainly would recommend that, and I could bring that back, because what's interesting, phase 2 includes libraries. Isn't that correct? And not that a senior center is the same.
I honestly don't know.
Yeah,
I would think
I can check into that too. I do think that precautions around our seniors and older folks, those restrictions are going to be some of the last to be repealed. That's not the right word, but changed, just because of the high risk group, and where we see people most at risk, right, at advanced ages. But we can certainly find out. I know Jillian sends out you send out probably a daily email and or close to it, and with all the governor's changes, and I do as well. And any executive order, we both send it out. So if you do want to get on our mailing list, that's a good way. And immediately when there's an executive order about this, you'll hear about it the same day.
Sounds good. Thank you.
And you can sign up the same way. Just send us an email and we'll put you on the list.
Okay.
One of the things my doctor told me is that not to go anywhere until there is a vaccine developed. I can go to the store if I go for a very short trip or something like that, but not to mingle with people until there is a proven vaccine. So I guess maybe that's the kind of advice that they're looking at. Wow. Like for gyms or for elderly people or.
Well, let me say that I respect your like, I'm not a doctor, so I do not want to in any way undermine what your doctor, listen to your doctor, not me, is essentially what I'm trying to say in terms of your personal health. I think that there are going to be
somebody I just heard on TV. Anyway, go on. I'm sorry.
Is that right? Well, that kind of globally speaking, there's only so many months that people are going to do this. And the governor even kind of alluded to this a couple of weeks ago, that he's thought that he could see public support kind of fraying. And I do think we're going to have a long, hot, somewhat miserable summer, because everybody is playing. The end game here is the fall. is to be able to send the kids back to school, everybody back to work. Like that's what, I'm not saying that's definitely going to happen, but I think that's what the goal is. And so we were seeing summer camps canceled. We're seeing like this, the summer is, I mean, we're seeing a lot of, things slowly ease up, but it's not going to be what any of us want. And I've had it described actually by our school superintendent here in West Hartford as he doesn't want to sacrifice what we have to do, which means getting kids back to school in the fall for things that we want to do in the summer, meaning like summer camps and that kind of thing. So I guess my point is that I do think we're going to see some easing of the restrictions, but it's going to be slow going for the next couple of months with the hope of things are going to feel different in the fall. But then you hear people say, though, that we might get another wave at some point, right?
Mm-hmm. And I think, unfortunately, for those in higher risk populations, you are going to be the last to see these restrictions lifted. And that's a challenge because, to Derek's point, it's already wearing thin. So I all of a sudden will remember, like, to Derek's point again, like, hasn't happened in 100 years. There's no playbook. We're all experiencing this for the first time. My son at the beginning of this kept saying things like, well, did that store close the last time this happened? And I finally got through to him. I'm like, this has never happened before. Like, like things haven't closed, So I have to remind myself that too, of like, this is really hard, but it won't be like this forever. And that's easier said than done, but it will get back to some kind of normalcy at some point. I don't want to say to you too, like, oh God, you have to wait till the vaccine comes out, but I know that there's lots of people working hard on that too. So the hope is that that will come out sooner than later. And I think once that starts to get rolling, we'll see like how quickly things can change too. But we're all just learning as we go. Well, thank you, everyone. This was a real treat.
Yeah.
Thank you so much for doing this.
Happy to. And as Derek said, we're, if you're in other groups or you want to have another chat, please think of us and we're happy to Zoom on with you.
Yeah. Thank you so much for spending part of your Friday afternoon with us and anything that I can do, to help, like I said, whether it's getting your cable fixed or whatever, that's what we're up to nowadays, as legislators, just trying to help you in any way that we can. We'll leave the legislation probably to another day. So, but I hope you have a nice long weekend and stay healthy this summer and hope to connect with you soon.
Yes.
Thank you.
Thank you, everyone.
And Jillian, thanks again for arranging for access to everybody.
Happy to. All right. Enjoy the weather.
You too. Bye-bye.
Bye.